All right, this presentation is going to be for those people that have been diagnosed with left-sided heart failure, and or maybe you don't know what type of heart failure you have, left-sided or right-sided. They didn't bother to tell you, but through this presentation, you'll get a better understanding of one of the two different types of heart failure, left-sided heart failure. And I wanted to do this one first because this is the one that is most prevalent. After this, at the conclusion, you'll have an opportunity to request a guide to help you to monitor all of your information, to help you take better care of yourselves. And I have my email address at the end of it, so you can request that guide for free. I will send it to you for free. Um, but you can also request it directly through PCNA, which is the Cardiac Nursing Association for Preventive Measures that I'm a part of. You can request it directly from them as well if you don't feel comfortable giving out your information. But it's important that we go over this and that you get the guide so it can help you take better care of yourself at home. First of all, I want to talk about how big of a problem that heart failure is in the United States because we have 5 million people in the United States that have been diagnosed with heart failure, and that number is increasing every year. And we also have hospitalizations that fall every year within the 1 million range. And a lot of those hospitalizations are from people that have not been able to take care of themselves properly at home. And that's one of the reasons I want to help you with the guide at the end of this presentation and to get it to you so you can help take better care of yourself and stay out of the hospital. Because you see that, and number three is the cost every year for care for heart failure patients runs $32 billion. And that is a significant cost for a very complex problem to take care of. We looked at some of the causes of heart failure in my first video, but specifically the causes for left-sided heart failure have to do with ischemic heart disease. And ischemia means that there is a narrowing of a blockage in one of the heart arteries, or it's narrowing to the point that it is approaching having a blockage. Another cause is hypertension. We talked about high blood pressure and how it causes fibrosis in the heart and causes those heart muscle fibers to stiffen. And another problem can be if there is valve disease. There's two valves in the heart that's called the mitral valve and the aortic valve. And if you hear your cardiologist tell you that you have problems with one of the valves, they usually are saying that it is either has stenosis, which means narrowing, or they're saying that it has insufficiency, meaning that it is allowing blood to leak back into the heart and not everything is being pushed out. And when you have the regurgitation, that's what causes the heart murmur sound. If they tell you that they hear a heart murmur, that's what causes the murmur. The movement of it against the flow trying to get out and when it falls back in. Sometimes it can be heard as like a rushing noise. Other times it's just a click to let you know there's stiffness there. The last reason is if you have a disease condition of the heart, such as amyloidosis. Now, amyloidosis is primarily what you hear of with Alzheimer's disease. It is all connected. But if you have a disease such as that, then it also can cause the heart muscle to be stiffened and less resistant to be able to pump. Okay, and talking about ischemia and heart disease, and when there's a narrowing of the vessel or where there's a vessel that becomes completely occluded and there is ends up being damage to the heart. What you see over here on the left side is this area right here where it says that the area is blackened, or there has been a death of that particular area of the heart muscle. And you see the area that says LV, that's the left ventricle. That's what pumps all the blood out to the body. So you see in the second picture of the heart, you see how that blackened area has extended. And that is after the heart muscle's damage has actually stopped, and they've stopped it by doing some sort of intervention. When they stop that, that particular area of the heart that's been damaged, that function doesn't come back. That area is dead. So what you will see is that area that says where the LV is, that left ventricle that pumps that blood out to the body. Do you see on the right hand side how that area is a lot bigger than what you see on the left? Because whenever they had the heart attack on the left side, it was just a small portion that was damaged and wasn't really affecting the way that heart could beat and function. But after all of that damage set in, and there was that much heart muscle that couldn't really move anymore because it was dead tissue, the rest of the heart had to do what they go through, a remodeling process, is what they call it. And that remodeling makes the heart change shape to still be able to do its job, but it doesn't do it as effectively. And you can see why. Because of that blackened area on the bottom of the heart muscle, the rest of the heart muscle is having to expand to take in that workload that that section of the heart doesn't isn't able to do anymore because those cells are dead. Does that make sense? So in this picture, I primarily want you to see that on the left side, you have the heart that has the initial heart attack. And then on the right side, you have the increased LV, which is left ventricle, from the changing of the formation of the heart to respond to that dead tissue and still enable it to be able to work in pushing that blood out where it needs to go. It just can't do it as effectively because it's got dead heart tissue there. And that's why they always say time is muscle, because you can't get it back once it's gone. Now, on this particular slide, I want you to see the different types of symptoms that you see with this type of heart failure versus what you would see with right-sided heart failure. And that's going to be my next presentation that I do so you can understand the differences. But with left-sided heart failure, you're going to have a lot of shortness of breath. Mostly when you exert yourself, you're going to notice that it's a lot worse. And as it worsens, you're going to notice that you have more and more difficulty being able to do things. So it is very important that you remain active as much as possible to try to strengthen the heart function that you have left. A lot of times you will have cough with this, a dry, hacking cough. Now that can be from medication. Certain medications cause that, but it also can be from the fluid buildup. Also, it is very common to see tachypnea, which means breathing fast. You can't slow it down because you feel like you have air hunger. Another common symptom is diaphoresis. By that, we mean that you're in a cold sweat. You are just reeking of sweat just with the least little bit of exertion. Another common problem is weight gain, but the weight gain is due to you retaining too much fluid. So it becomes very important to really read labels when you go to the store and really watch how much salt that you have in the food that you're getting, because it can really make a difference in how fast you gain the water weight. And it's going to affect the way you feel. You're going to feel like crap if you have too much water retained. You're not going to feel like doing anything because you're not going to be able to breathe effectively. And everything ties together. Another thing that you have to watch out for is you'll notice that you get very easily fatigued. You might have a lot of things planned for the day, but you might find out that there's a lot of those things on that list that some days you just don't feel like getting much done. And it's going to be that way. Some days you'll feel more like doing things than others. But it's important to try to push yourself to do as much as you can, because once you lose function, it's very hard to try to get it back. Another thing that's common is the extra heart sounds that I talked about. When your doctor may tell you that you have a murmur, maybe you can ask them if you can listen to it. It can either sound like a click, an extra sound whenever those valves at the heart are closing. If they're stiff, then they'll click shut, and it is actually a clicking noise. Otherwise, if it is an insufficiency problem in which the blood is leaking back in because it's not all getting pushed out, then you're going to hear more like a swishing noise from the blood leaking back into the heart against that blood that's going out. Sounds like a washing machine sometimes. Depending on how bad the murmur is how loud it will be. Now, when you start getting really bad heart failure to the point that it's very difficult to really do anything anymore, then you start having to watch for mental status changes, because people will just get sleepier. They won't feel like doing anything. It'll be very hard to stay awake. You'll notice there's periods of confusion, and then it really becomes a concern because they can't stay awake long enough to be able to stay active. And that really becomes a problem. And you'll also notice that as the disease progresses, that the capillary refill, the refill in the fingers, if you pinch somebody's fingernail, it's going to hurt. But if you pinch the fingernail, that color should come back within a couple of seconds. As the heart failure worsens, you're going to notice that it takes longer and longer for that color to come back in the nail bed once you pinch it. And when it starts getting greater than 3 seconds for it to refill, then you can start seeing some signs of cyanosis. And by cyanosis, I mean that you can start seeing some bluish coloring in the nail beds. And once that coloring starts changing, then you know that they're hanging on to more blood that needs oxygen, and that they're not getting everything perfused throughout their body as well as they should. And so all of this stuff is just backing up. All of these symptoms are for left-sided heart failure, and they're different for right-sided. So once we get into right-sided heart failure, I will go more into those. But I just want you to have a good understanding of this type of heart failure because it is the most common. All right, when we talk about symptoms for left-sided heart failure, the shortness of breath on exertion is usually the one that you see the most, and it is usually accompanied by a dry hacking cough. And like I said, that can be caused by certain types of blood pressure medicines, but it can also be a symptom of the fluid starting to back up in the heart if you have been diagnosed with heart failure. And it's a very annoying cough because you can't bring anything up. It's just a dry hacking cough. But as you get worse with heart failure, as your heart failure starts to progress, you're going to notice that you have to sleep sitting up because when you start getting into a point that you are in reaching distress, you're going to notice that anytime you lay down to try to sleep, you're going to feel like you're suffocating. So that is one of the characteristic signs that there's some kind of intervention that needs to be made, and you need to be calling your doctor. Because if you're sleeping sitting up and you can no longer lay down to sleep, that means that some changes need to be made to keep you from going back in the hospital. Now, another thing that we need to talk about is over time, as your heart worsens in condition over time, it's going to affect the ability to pump all the blood to all the different parts of the body, to exchange blood and oxygen and nutrients in the blood, exchange the oxygen and nutrients in the blood to the cells, and then take out the waste products and take them back to the heart so they can be filtered out by the kidneys. Well, what happens is all those waste products start backing up because there's decreased perfusion of the blood to the kidney. After the heart starts to fail, well, then eventually everything else starts to fail too. So it's so important once you have this diagnosis to take the best possible care of yourself as you can and to stay out of the hospital because once you start down the path of getting worse, you can't get the function back to the level of where it was. There's going to be a decline every time you have a setback. And that's why it's so important that you take good care of yourself. And I know it's a pain. I know it's a pain. It was so tough to go from using salt on food, but I found that those salt substitutes actually had more spices and tasted better. So it was easier for me to make the switch. Now, in my case, I had to switch because of my blood pressure, and I don't want to develop heart failure because of my blood pressure. So I knew I had to change, take the salt out of my diet, and so they made sure they're on me about that because I'm one of those people that salt is extremely sensitive to my system. It will send my blood pressure up into orbit. So I have to be very careful about the salt intake. And there's a lot of people that are that way. And if you're one of those people, you're going to notice that when your blood pressure goes up, you feel like crap and you don't have any energy. Well, there's a reason for that. It's because you're stressing your heart more with that increased pressure. And that's why it's so important to keep your blood pressure under proper control. Now, another problem that you have with left-sided heart failure is decreased cerebral perfusion of the brain. And when that happens, you start having problems with, you can have problems with strokes, you can develop actual blockages from the blood not going through. You also can develop problems with cognition. People have trouble with memory, keeping things straight, have to write themselves lists because they can't remember stuff. All this will come in time as the heart failure gets worse. So you just have to be mindful to try to make sure that you do everything you can to stay as healthy as possible for as long as possible. Because once a person has a diagnosis of heart failure, the lifespan after that diagnosis is usually 5 years. However, if you don't take care of yourself, it can be a lot less than that. Okay, well, let's look into how we treat left sided heart failure. First of all, you got to reduce your salt intake. That means you have to cut back and watch those labels and make sure that you don't have as much sodium as in your food as you might like. Learn to season it with other things. Also means you're probably going to be put on a diuretic, which means it's going to be one of those blood pressure pills that pulls all the fluid off of you. And that's why you have to watch your salt intake, because it doesn't really do any good to pull all that fluid off if you're going to be eating a bunch of salt, because you're just going to put it back on and defeat the purpose of taking that diuretic. We have to sometimes give drugs to increase the contractility of the heart. Once that heart muscle starts to get big, as it remodels, sometimes it doesn't function as well and doesn't pump as hard as it needs to get all that blood pumped through the body effectively. So we can give a medication that's called a positive inotrope, which makes that heart beat harder. And we can also give medications to reduce the afterload and kind of minimize the resistance of the blood vessels and help them ease a little bit to help the blood flow through easier. Now, if you would like a copy of the heart failure guide to help you keep track of your vital signs and how much activity that you're able to do every day, so you can really keep track of it and just really give yourself credit from when you start the journal until after some time passes, and you see how much a difference you've made, because you may be able to start out only walking a couple of minutes without tiring out, and then you look at that journal a couple of months later and you find that, hey, I can walk 10 minutes without tiring out. So, excuse me, it's important that you have those kind of guidelines that you can look back and you can see progress and see how well you've progressed. And not only that, when your doctor asks you for certain numbers, what your blood pressure's been running, that kind of thing, you have that information for them right there in that journal that you can give them to let them know that, hey, I care about myself. I'm doing what I can to take care of myself. I have these tools and I'm using them, and just let them know that you're serious about it. Because a lot of times I think it's difficult for doctors to understand that this disease is so complex that you can just have days where you're just like, this is just overwhelming for me to try to keep up with. But you have to realize that that too will pass. But at the particular moment when you have that feeling, you're just like, this is too much. But it'll pass. I promise you, it'll pass. because we've all been there in one way or another, whether it's with heart failure or a different condition. But if you want a copy of this journal, it's a 48-page guide. It's got all of the documents that you need to log your weights, to log your blood pressures, to log your exercise, to log what your plans are for the day versus what you're actually able to achieve. So you can look back and reference the next day. It has a lot of good information. I will give it to you for free. Just promise me that you will use it. Email me at my email address of RN for a Healthier You, and I will get you a copy of it. If you send me your email, I can email it to you. If you don't feel comfortable giving me your information, you can contact pcna.net directly. Ask them for the information. Make sure you let them know that I referred you and that I'm with their organization. Otherwise, they might try to charge you for it. But please get this guide in your hands to help you to see the progress that you make over time. And then I want you to let me know periodically how you're doing. Because, like I said, heart failure is a very special topic to me. Excuse me. Because my grandmother had it, and because I have seen working in the ER how much things get missed in terms of education and everything for heart failure patients because of the many times they end up coming back into the hospital. And I want to do everything I can to help you succeed in taking better care of yourself. So I'm here for you. Have a blessed day and contact me so I can get you that guide. Thank you. The information from this presentation came from the Robbins Basic Pathophysiology book. All of the information contained on heart failure came from the section in that book explaining everything about the changes in the heart.